Welcome back to the show, and thank you for joining us. We're talking to you now about a topic that's quite concerning.
Yes.
Ovarian cysts. May sound quite alarming, but what really is ovarian cysts? And let's find out more answers with some questions.
Yes, hello. Let's say hello to Dr. Ragu, specialist obstetric and gynecologist from Hostel Tuanku Ampuan Rahimah Klang.
Hello, hi.
Thank you very much for joining us.
No problem.
Please do break the myth of what is ovarian cysts, the definition.
Well, to define it simply, ovarian cysts are sacs filled with fluids or semi-solid material, and they occur on or within the ovary. Now, the word ovarian cyst seems to actually encompass every ovarian tumor that you may find. And so when you're actually looking at perhaps a patient in the medical, with a medical view, we sort of more name it as an ovarian tumor. A tumor is basically a neoplasm, a new growth. And we then decide whether there's a possibility that this tumor is something more than we hope for, something more than just a simple benign growth. And we do test investigations to sort of risk, to calculate a risk for it. And then the treatment would be based on that risk.
So, how prevalent, doctor, are these cysts?
Quite very, very common actually, and you'd find them occurring probably in about 1 in 4 to 1 in 5 women at any point of time. And we do find that there are some cysts which are functional. Physiologically, they actually occur at certain points of time in a woman's life. And we find that they tend to disappear. So sometimes if we are, I suppose, overly suspicious, we end up treating the patient, and then sometimes we find that it's actually not necessary. So because of that, that risk assessment is very, very important for us to decide who needs the treatment and in which patient we can possibly just wait and allow it to disappear by itself. And physiological cysts, they do disappear by themselves as well.
Is there types of ovarian cysts?
Absolutely. Most cysts are divided or sort of characterized from where they occur. Within the ovary, we do have different cell lines, different layers, and depending on from which particular cell line, that the cyst appears, we name them accordingly. And of course, each different types of cysts carry different risks, carry greater risk in some and less risk in others.
Okay.
Well, we've seen sizes of cysts or tumors that are quite scary and frightening, really. So, when do these tumors become such a problem?
Unfortunately, with ovarian cysts, and this is a worldwide occurrence, a lot of the cases are found quite late. I think the main reason would be a woman's ability to withstand certain complications or certain problems which they find it's not disturbing them too much. I don't think any man would probably be able to stand some of that, but unfortunately they do with their normal lifestyle, taking care of the kids, the home, jobs as well. They sort of ignore subtle signs, and ovarian cysts or tumors, they don't really, they don't produce any significant or particular symptom that would make somebody think, oh, I've got something in there. So a lot of them finally realize something's wrong when the abdomen is really grossly distended, first and foremost. And some of them, they have other signs like a loss of appetite, loss of weight, bowel symptoms, and that's when you actually go and seek medical help.
Do share with us, what are the subtle signs?
Well, any feeling of not being well, that would probably be first, I would say. If you're not well, just get an opinion. The simplest thing. If you find that you're putting on weight initially, and you seem to be exercising, you seem to be actually taking care of your health, but weight is still going on. You find your clothes getting a little tighter around the waist, perhaps, and you find you're getting tired more frequently, or your ability to actually do a lot of work is diminished. Those kind of things start off your suspicion. But I would say yes, any irregularity in your menstrual cycle, any these are probably more specific, any irregularities in menstrual cycle, any sudden increase in abdominal size, any abdominal pain, any bowel symptoms, I think we should take those symptoms seriously.
Are ovarian cysts tied in with fertility issues?
Absolutely. Some of the ovarian cysts are actually induced by medical assistance, and especially in assisted reproductive techniques, we do stimulate the ovaries to produce more eggs, and these eggs are produced within follicles, so you tend to get some women really get an increased number of follicles. Now, if one does not get pregnant, that 9 months of pregnancy is actually a protective measure against cancers of the ovary, and what we find is women who are not getting pregnant, they tend to have a slightly higher risk of developing ovarian cancers.
Okay. The myth is, how young can a person to have ovarian cysts? Is it as early as once hit puberty at 10 or 12?
It's very rare, but we do see, or we have seen cysts occurring in little babies as young as 3 years old and 4 years old. We've done surgeries for them as well. Luckily, they were benign. On occasion, you do have cancers that occur within the ovaries, and we have to remove them. But majority of the cysts occur, the physiological cysts occur in the fertility age, anywhere between probably attaining puberty and towards about 35, 40. Beyond the age of 35, 40, you're starting to look at probably more pathological cysts, malignant changes within cysts and all that. So yes, you do see them at very early ages sometimes.
Why do they occur? Are there any specific reasons or any protective measures that women can take?
Well, unfortunately, there isn't anything established right now. We're talking about screening programs and all that, and we found them not to be too effective. The nature of the screening, which are blood tests and transvaginal ultrasounds, they're not very nice to go through, so a lot of women decline those screening procedures. And while there are a few advances in blood tests that may show you the presence of a cyst or the possibility of a malignant cyst, they're not very specific. They can't be used in large populations. So unfortunately, screening is not a problem. Genetic counseling is. We do know that some of the ovarian cysts and tumors, they are hereditary, and when you assess the risk of the family, the first degree relatives, sisters, aunties, mothers, we then talk to them about their children and say, look, you have a high risk. There are certain problems, genetic problems, which predispose your children to cancers, ovarian masses, breast masses and all that, and you tell them to get that genetic testing done and counsel them what we can do for them to reduce the risk. Absolutely.
Well, we've already mapped the human genome code, so
absolutely, that's
possible.
Yeah, the step forward in everything at the moment.
Well, let's take a quick look at this visual that we have. It's quite scary, really. What causes a tumor or cyst to get to that size and the woman not notice?
Sure. Would by any chance we go back to the previous slide?
Let's take a look at the... yeah, that one, I think.
Yeah, so this was a patient who actually presented to us with a huge abdomen. Now, she's had this for about 2 years. So that goes to show you how much a woman can actually tolerate pain, discomfort and all that. I still reiterate it, no man can go through this.
Right, I mean that's quite frightening. If that kind of physical change would have happened to you, I think you would notice, but she seemed to believe that this was just normal.
So when we did the surgery, as you go to the next slide, the entire thing is actually the ovarian cyst itself. And we were lucky, this was completely benign, but it was filled with mucinous material, semi-solid material. We were lucky it was benign, but there's always a potential it could have turned cancerous somewhere down the line.
Okay. And how old is the patient?
This patient was only 44, 45 years old.
Usually, as you say, after 40, a very high risk, or it turns to something very...
Yeah, a little bit more sinister than we'd hoped.
Okay.
How did it get that big, doctor? What fed the cyst? What kept it growing?
The problem with cysts is there's nothing that you can do to prevent its progress. It's decided that it's going to grow.
Even in terms of prevention?
Unfortunately, not with ovarian masses.
Cysts.
Absolutely, yeah. There are a few things that you can always take into consideration. Good, healthy lifestyles, of course. Contraceptive tablets, contraceptive measures. Every year of use of contraception reduces your risk of an ovarian tumor or cyst tumor by about 1 to 4%. So there are certain advantages to contraception as well.
Okay.
And they might just disappear, or they might just turn and grow.
They don't occur in the first place. It reduces the risk of them occurring. If they're going to occur, unfortunately, there's nothing much we can do to sort of make it disappear. Yeah.
Okay. Can you share with us any website or information where where women can start reading up, or just go to your gynecologist and just do a screening?
Absolutely. You're looking at most obstetric and gynecology colleges, the American college, Australian college, it's all available online. They do produce a lot of information that you can read. National Cancer Society of Malaysia has a website, and I think the best websites so far are the ones coming out of Australia, the Queensland Cancer Society, and it's all just easily available online.
Well, there you go, ladies. I think you should head out there, get as much information as you can about where you can go to find out firsthand what ovarian cysts is all about and your risk factor. You should basically go and check. 1 in 4 women was the statistic that you gave us earlier, so that's still about 25% of the female population.
And Doc, maybe you can share with us more about genetic counselling. Who is the right person for you to see? Is it normally you go to your gynecologist, or is it another particular specialist on that?
Most of the genetic counseling it starts off with from a gynecological oncology clinic. Now, most of the hospitals, the major hospitals in Malaysia, they do have dedicated gynecological oncologists. So when we say patients with ovarian cysts, the risks are assessed, they are then referred to certain to these oncologists. These oncologists would refer them to a genetic counseling unit. Right now in Malaysia, it probably be within the university systems. The general hospitals do not have a lot of the counselors yet. And what they do is the counselors actually assess the risk of the family and the patient themselves, and then take it from there. And there are certain genetic changes within the DNAs that predispose somebody to as high as a 40% chance of an ovarian cancer. So if you have a strong family history, it's probably a good idea to have a checkup yearly and assess the risk as well.
Are there any other alternative treatment for ovarian cysts besides surgery?
At the moment, no. Surgery seems to be the principle of management of all ovarian tumors.
Is laparoscopy one of the... So I think a lot of people, as you see just now, was a very huge cyst, but again, a lot of people are looking towards laparoscopy because of the benefits. So
absolutely,
share with us.
the surgical benefits are beyond doubt. The recovery time is so much better. The only concern we'd have is if the risks are slightly higher, that this is more than just a benign case, spillage from that particular cyst would actually seed malignant cells within the abdominal cavity. So one of the main things that we do take care of is to avoid any spillage. Now, with laparoscopic procedures, we're using little tiny holes, 10 millimeters, 5 millimeter across. Imagine trying to get that mass out of a small little hole. It's impossible. You have to drain it. And draining without spilling is virtually impossible laparoscopically.
Well, that looks quite graphic, and I know if you're watching this right now, you're quite worried. Do check with your nearest physician, and do look up at those websites that good doctor mentioned. Doctor, are there any final words you'd like to say to ladies out there?
Absolutely. As I said, there's no screening test available, but the best thing that you could possibly do is have your pap smears. While you're having your pap smears, do express the need for an abdominal examination by the practitioner who's doing the pap smear for you. It may be a nurse, it may be a doctor, it doesn't matter. Even that little ounce of suspicion that they might have would lead you to come and see a doctor and get the early treatment. And that treatment at an early stage is probably the most important thing.
Okay.
All right, on that note, thank you very much, Doctor, for being here on the show. It's been fantastic talking to you, and I know we learned a lot about ovarian cysts.